Hello, everyone. Welcome back. This is Mike. Today we continue our discussion on cerebrovascular disorders, diagnosis, management, and prevention. We will talk about intracranial hemorrhage. Intracranial hemorrhage, or ICH, refers to acute bleeding inside the skull or brain. It's a life-threatening emergency with bleeding into the brain parenchyma. Most frequently, it is caused by hypertension, which is often complicated by Charcot-Bouchard aneurysms, which are minute dilations at small artery bifurcations that may be sites of hemorrhagic rupture. Most often occurs in the basal ganglia or thalamic area. Also the pons, cerebellum, and frontal lobe white matter. Other causes include arteriovenous malformations or AVM, cerebral amyloid angiopathies or CAA, neoplasms, vasculitides, normal hemostasis, hematological malignancies, and infections. Clinical presentation includes severe headache, frequent nausea and vomiting, steady progression of symptoms over 15 to 20 minutes, and coma. There are 4 types of intracranial hemorrhage. First is epidural hematoma. The second, subdural hematoma. The third, subarachnoid hemorrhage. And lastly, intracerebral hemorrhage. An epidural hematoma occurs when blood accumulates between the skull and the outermost covering of the brain, called the dura. It typically follows a head injury, and usually with a skull fracture. High-pressure bleeding is a prominent feature. Patients with an epidural hematoma may briefly lose and then regain consciousness. A subdural hematoma is a collection of blood on the surface of the brain just beneath the dura. It's typically the result of the head moving rapidly forward and stopping, such as in a car accident or a child being shaken. A subdural hematoma is more common than other intracranial hemorrhages in older people and people with a history of heavy alcohol use. A subarachnoid hemorrhage is bleeding within the brain and the thin tissues that cover it, called the arachnoid membrane. The most common cause is trauma, but it can also be caused by a rupture of a major blood vessel in the brain, such as from an intracerebral aneurysm. A sudden, sharp headache usually comes before a subarachnoid hemorrhage. Typical symptoms also include loss of consciousness and vomiting. Intracerebral hemorrhage is when there's a bleeding inside the brain. This is the most common type of intracranial hemorrhage that occurs with a stroke. It's not usually the result of injury. A prominent warning sign is the sudden onset of neurological deficit. This is a problem with the brain's functioning. The symptoms progress over minutes to hours, and they include 1. Headache, 2. Difficulty speaking, 3. Nausea, 4. Vomiting, 5. Decreased consciousness, 6. Weakness in one part of the body, and lastly, elevated blood pressure. What are the risk factors of intracranial hemorrhage? Most intracranial hemorrhages are due to head injury. Any activity or lifestyle choices that increases the risk of head injury can lead to intracranial hemorrhage. These factors include 1. A family history of intracranial hemorrhages, 2. Heavy alcohol use, 3. Hypertension, 4. Cigarette smoking, 5. The use of certain illicit drugs including amphetamines, cocaine, and MDMA, otherwise known as ecstasy, and lastly, extreme physical exertions. Now, what are the symptoms of intracranial hemorrhages? The signs and symptoms of intracranial hemorrhages vary depending on the type, but they usually include the following. 1. A sudden and severe headache. 2. A headache associated with a recent blow to the head. 3. a mild and long-lasting headache. 4. A headache accompanied by neck stiffness. 5. Confusion. 6. Drowsiness. 7. Vomiting more than twice in 24 hours. 8. Seizure. And lastly, coma. What are the steps in diagnosing intracranial hemorrhages? Well, the first step is a CT scan of the head. A CT scan can show abnormalities in the brain like swelling or clots. The second step is when the CT scan may not show any sign of intracranial hemorrhages. A lumbar puncture or spinal tap may be done to test the spinal fluid for blood. So how do we treat intracranial hemorrhage? Intracranial hemorrhage is a medical emergency. Survival depends on getting treatment right away. First is surgery. It may be necessary to operate to relieve the pressure on the skull. Drilling a small hole in the skull releases blood. Drilling a larger hole or removing a piece of the skull may be necessary to remove a blood clot. Medications that may be necessary includes the following. 1. Steroids to reduce swelling. 2. Anticoagulants to reduce clotting. 3. Anti-seizure medications. And lastly, medications to counteract any blood thinners that the patient may have been taking. Complications of intracranial hemorrhage includes all of the following. 1. Seizures. 2. Paralysis. 3. Headaches. 4. Brain development problems in children. 5. Memory loss. 6. Dizziness. And 7. Difficulty concentrating. Preventing intracranial hemorrhage involves preventing head injuries. Basic preventive measures that can help avoid head injuries includes the following. 1. Always wear a helmet when riding a bike, motorcycle, skateboard, or scooter. 2. Always wear seatbelts. 3. If older, try to avoid falls. What's the long-term outlook of intracranial hemorrhage? The outlook depends on the severity of the hemorrhage and how quickly a patient gets medical care. Remember, intracranial hemorrhage is a life-threatening condition. Depending on the severity of the hemorrhage, draining a hematoma can lead to recovery. Physical or occupational therapy is sometimes needed to help a patient return to normal activities. This ends our discussion on intracranial hemorrhages. See you next time when we discuss cerebral aneurysms.